Welcome to Ravens Over. Please subscribe to my channel. If you have a story you want me to cover, you can email me at ravenover@yahoo.com. At the top of the Instagram, it's the Instagram button. If you follow me, I will follow you back. Subscribe yet? Let's go to the video. Let's go.
Hey! What's up, what's up, what's up? How you doing? How you been? What's going on? What's good? How you getting it in? About to get in the fight. What's going on, people?
Okay, I want to do this story about transgenders and stuff and a study that's been done. And I want to share with you and stuff. And a lot of times I believe a lot of girls and also the guys, you know, they basically give up on having protection or some such situations unseen has happened in them, or there was in a relationship, basically the person took the protection off and gave it to them, because you know it's a lot of ways. But I want to share this with you because it's going out as far as April 26, 2018. Now, new U.S. Centers for Disease Control and Prevention (CDC) Director Robert Redfield, MD, set ambitious goals for the agency staff ending the HIV epidemic in the nations in the next 3 to 7 years. In the remarks as reported in The Hill on March 30th, Dr. Rosenfeld cited the advances made by therapeutics, including HIV, and the resources now widely available to risk population, including condoms and screening programs. However, advocates within the HIV/AIDS arena knows that the significant challenges remain. Among them, addressing the incidence of the disease among transgender population and encourage those who identify as transgender get tested. In 2016, the U.S. public health community has observed National Transgender HIV Testing Day each April the 18th, announcing the effect of connections with events in emails sent out last week. The CDC shares some troubling statistic among the agency. 22% to 28% of transgender women are living with HIV, as are a estimate of 56% of Black African American transgender women. A paper published in 2016 suggests as many as 1 million Americans currently identify as transgender. National Transgender HIV Testing Day is an opportunity for transgender people to get tested for HIV, know their status, to promote HIV prevention and treatment efforts. The agency said in an email last week, HIV testing is the first step for people to living with HIV to begin treatment, which can keep them healthy. The sooner people living with HIV learn their status and start treatment, the more they benefit. Now, treatment can also help prevent transmission to other people. People living with HIV who take the HIV medicine and prescribed as achieve to maintain viral suppression have effectively no risk in transmitting the HIV and HIV negative sexual partners. Now, among the 40,000 new cases of HIV are diagnosed annually in the U.S., the CDC report, although the cases among transgender individuals are relatedly rare, with a little more than 2,300 documented diagnoses between 2009 to 2014. According to the agency, they may also be underreported because of what officials describe as the challenges of accuracy, identifying and report gender identity in HIV surveillance. In tandem with the year's National Transgender HIV Testing, the CDC has implemented several initiatives to order improvement testing rates among transgender Americans, including providing additional funding to communities based on organization offering testing programs, as well as boosting Project Pride, which supports health departments' effort to provide PrEP to transgender women. The agency also be offering new continuing medicine. Excuse me. The agency will also be offering a new continuing medical education program designed to assist healthcare providers with delivering patient-centered HIV prevention and care to transgender individuals. So, they're saying tests have been done and stuff, and basically the epidemic has not, it hasn't gone down. And according to this report, they're saying that, that among the agency that trains the population courage that identify, get tested and stuff, and there's remorse as far as the health that's Robin cited the advances in making therapeutic, including HIV prophylaxis, and available for risk and stuff like that. And basically they're stating that transgender HIV rate remains high. It hasn't gone down, as far as they kind of like saying that a lot more people may be HIV positive, but they're not really sure of the rate, that it may even be more than being diagnosed. And a lot of people are living with HIV, which HIV is HIV, and it's not treated, turns into AIDS, in case you don't know that. And basically you're not treated, so by you not knowing it, you're sharing the disease and you're transmitting it. And basically they're saying that, I guess in April, they're going to be doing like a we're in April now. So in April the 18th, which is already past, January, February, March. It's already past the HIV screen and stuff like that. So, the thing about it is, get yourself tested if you can. I know it's hard, to get this type of diagnosis. It's scary as hell, and I agree, because when it came to me, we'll get tested and stuff like that, I was a little nervous. I was shocked that I didn't have anything, but when you go get medicine and stuff like that, they automatically want to do testing and stuff, especially when you go to the clinic, as far as getting your not HIV, but the hormone pills. And if you want to get the, before your treatment, as far as getting on hormones, they automatically make you take a test. They make you take a test for everything, not just HIV. I mean everything. Chlamydia, gonorrhea, they give you the whole thing. Now, me myself, I didn't know about this. I just knew about the HIV testing, which was not a big deal to me, because I knew I was safe. But that does not mean I was not exempt, because I know a lot of times we do use a lot of protection and stuff like that, but that's not 100% proof. A lot of times I feel like a lot of times these guys have sex with us, and they'll take the condom off, and at the moment you're not really thinking that he took it off, he actually had, because you gotten so wet and stuff. Me myself, I have trust issues, so anything feels a little different while I'm in this inside of my body, I'm automatically going to stop them. And a lot of times I learn in this world we live in, when it comes to dealing with straight men, they love to take the condoms off because they think it feels better. But at the end of the day, he isn't getting tested. He doesn't. A lot of times I learn, with my life, that a lot of straight men do not get tested. So your body is your temple, so protect yourself. Don't care how much they say, oh, I'm good, I don't have anything. He's not a doctor, you're not a doctor, and at the end of the day, he could tell you anything. Protect your body, protect yourself, because at the end of the day, he give you something. He done gave you a fake name. Here it is, you thinking that the man love you. He done lied to you about his name, you know where he live at. But at the end of the day, he gave you something that you could never forget about him for the rest of your life. So protect yourself. So I want to share this with you on this Saturday and stuff. And like I said before, the study done in the wake of a national transgender HIV awareness day suggested there is more work to be done. And it was reported as far as April the 26th, 2018, which is a couple of days ago, but I'm sure it went out a little earlier than that. So, I love your feedback on this. Let me know how you feel about this. I do feel as though a lot of times when it comes to the girls, like myself, we get so comfortable with these men, and he'll be like, Ma, I ain't got nothing, let's take the condom off. And just like for the devil's advocate, you say, you know what, I trust him, we're going to get tested. You go get tested with him, find out y'all both negative. Then all of a sudden he steps out on you and he gets something. He's not gonna come back and say, guess what, I cheated on you. We need to use protection till I get tested again. He's gonna go inside of you raw dog. And I'm gonna tell you something, that word I'm sorry just don't work with me. And like I said before, you can email me at ravenover@yahoo.com. And also at the top, there's an Instagram button. You follow me, I'll follow you back. I wonder how you feel about this. Do you feel as though you should trust somebody because they say they good, they ain't got HIV? Do you feel as though you could trust someone because you're in love? Because remember, love make a lot of people in life end up dead. Love will love you to death, literally. Anyway, like I said before, please be safe, cover your body, protect yourself, protect others, and get tested. And I'll let you all love you. And thank you for watching. Get Siri.